Hi there, this is Dr. Tall Paul Simon, psychiatrist. Wanted to talk to you today a little bit about what it's like to be a psychiatrist. This video is aimed at people who are maybe thinking about becoming a psychiatrist or just a little bit curious about psychiatry and what it's like to be one. So please subscribe to this channel. It's encouraging to me. I find it reinforcing and helpful. I appreciate that. And if you have other questions, please feel free to ask them, and I'll try to answer them in a future video. So becoming a psychiatrist is not easy. So first you have to get into medical school. That's probably the hardest part, at least from my experience. So how do you get into medical school? Okay, well, you have to have an undergraduate degree. That's a 4-year degree at a college, usually majoring in something relating to science. And there's a whole lot of prerequisites to getting into medical school. Like, I think it's about 2 years of chemistry, a year of physics, and a good amount of math, and of course a lot of biology and different things like that. So these are very difficult courses and classes, and I know I struggled through them, and I know a lot of my colleagues did as well. So a lot of difficult courses, and then you have to apply to the medical schools using a system that consolidates all your test scores and grades and experiences into one big database, and then you apply to your different schools. Now, a big part of that application is what we call the MCAT, or the Medical College Admissions Test. And that's a huge test, kind of like the SAT or the ACT, that looks at what you know of math and science and biology, and it also has a writing segment where you have to write essays on different things. So it's a grueling test, and the higher you get, the better score you get, the more likely you are to get into the school of your choice. I majored in psychology in undergrad, and because I wanted to probably become a psychiatrist, and that's what I am, but most people major in some like hardcore biology kind of thing, like microbiology or biology in general, or chemistry or something along those lines. But regardless, you can apply to medical school no matter what your major is, as long as you fill out the prerequisites and do well on your courses and do well on the MCAT. I did a study course through Kaplan to increase my scores, so that I increase my chances of getting into medical school. Now, I am what's called a DO, a Doctor of Osteopathic Medicine. So we learn the chiropractic manipulation as well as the general medicine kind of stuff that an MD would. And we use the same licenses and have the same rights and practice rights and things as an MD now. 100 years ago, that was not the case, but a lot has changed. So I think it's about 15 to 20% of physicians are DOs. Now, I went to become a DO because I thought it was a little bit more holistic in its approach to education and training. And I think that's borne out in my practice as well. I think it's benefited from that. Medical school is grueling academically and socially. It's just nonstop studying. You're basically studying as much as you possibly can for as long as you can. I did have a bit of a social life, but it was pretty narrow, and it was difficult to squeeze in a workout here and there, let alone a social life. So basically, you really have to, most people, I'll speak for myself, have to become kind of a monk, studying just nonstop as much as they possibly can. And that goes for holidays and weekends, and squeezing as much time out of the day as possible to study. And it goes for medical school and getting into medical school. Now, there are different tests that you have to go through at different stages, and they test clinical knowledge and basic science knowledge. Now, after you graduate medical school, which is 4 years after your undergraduate degree, which is typically 4 years, then you go into residency, which is at least 3 years, can be up to 8 or even 12 years for some people, during which you get paid minimally. It's more subsistence level. That's when you're really getting a lot of hands-on experience. Your title is doctor, and you may be licensed as a doctor, but you're not independent at that point. You're still in training. It's kind of like an apprenticeship in a way. So that's where you learn a lot of general medicine things such as internal medicine and cardiology, neurology, emergency room medicine. And some people, will head over to surgical and interventional stuff, other people towards more internal medicine. So that's kind of how you get there, and you can go into private practice from there, or a blend of private and public service after that. And the money and job security is good, but the work is quite stressful because you're really caring for people and take on responsibility for people's lives in a lot of ways. Now, as a psychiatrist, after medical school, residency is tailored towards psychiatry. You start first year as internal medicine and cardiology, neurology, kind of these general medical fields, and then the second, third, and fourth year become more and more specialized into psychiatry. And then you take the a board licensing exam after that if you want to be board certified, which most insurance companies will require to be board certified. And hospital privileges as well. If you want to work in a hospital or a big system, you have to be board certified. Now, getting into a little bit of what it's like to be a psychiatrist, it's rewarding in a lot of different ways. It's a lot of responsibility, and I find that it's very emotionally taxing. I think any psychiatrist would agree with that. I think that's the case for most fields of medicine. There's an emotional component, I think, for anybody who's really emotional, and have emotions and feelings, and a caring person. You're bound to feel that because you're dealing with people who are suffering and looking to feel better and are in dire straits and coming to you. And when somebody comes to you asking for help, no matter whether you're getting paid or not, I think anybody who's human really feels that and wants to help the person as best as possible. So as a physician, you're getting education and tools to help the person, but at some point, a physician, and myself, included, really has to learn that we don't have a magic wand. We can't fix everything and every problem and relieve all suffering. Because life inherently contains suffering in all our experiences, and death is inevitable, in whatever shape or form it comes to us. So that fact of life and mortality, I think physicians are acutely aware of, and similar to other fields in which the professional is exposed to life or death situations that can be prevented or sometimes not prevented or can't be prevented. I think there's a certain camaraderie or fellowship in people who deal with life or death decisions and have been exposed to the uglier and brutal side of life in these ways. So as a psychiatrist, it's neat to be a part of a group of people who help people and deal with these things. It is kind of an elite group of people, kind of like if you join the military or you're a police person or a firefighter or something like that, and you deal with different things. You feel a connection with anybody who is in that field and has dealt with those same things. So as a psychiatrist, I feel that camaraderie with other physicians as well, though we're dealing with different aspects of human life and suffering and health and well-being than perhaps a surgeon or a radiologist is. We're definitely more in the trenches with people in their suffering. Psychiatry nowadays, we don't do a lot of therapy and counseling. It's a lot of medication management. And that presents a certain set of difficulties, not only just keeping up with the different medications, how they work as best you can, and dealing with the limitations of those. But sometimes I find it very difficult because a lot of times people come to me and their suffering is based on trauma or relationships that are dysfunctional. And as a psychiatrist, my tools are somewhat limited because my main tools are medications. Now, not all psychiatrists focus so much on medications, but the prescribing and maintenance of medications is a certain skill set that is in high demand. And you have to be a physician to be able to prescribe, usually. Nurse practitioners can, physician's assistants can as well. But so when somebody comes to me and they're really struggling in their relationships, and I have 15 minutes or a structure of an appointment that is built more for just medication management, it's presents a certain dilemma because I want to help and be there for the person. But the opportunity is limited to just be a therapist, because I practice more medication management than therapy. And, studies show that it doesn't take a physician to be a good therapist, otherwise there wouldn't be good therapists around, they'd all be psychiatrists or physicians, but yeah, you don't have to be a physician to be a good therapist. I feel that my responsibility and that I can serve more people effectively by using my medical knowledge and ability to prescribe than performing therapies. I can see potentially 3 or 4 people in an hour and helping them with medications potentially versus seeing one person for an hour and help with therapy, And certainly in a lot of situations, medications are really much more effective than just therapy. So like severe bipolar or severe anxiety or severe depression, these things, medications are clearly more effective than therapy. Therapy may be very important and necessary, but without the medications, they're not going to do nearly as well. So I feel like I'm obligated to see as many people as I can with as high as quality as possible. And that's a challenge. That's a balancing act. It can be quite challenging on a day-to-day basis, So it is difficult being a psychiatrist, I think, emotionally. There is a certain stigma to psychiatry as well. I think a lot of people don't believe in psychiatry, and that's never made sense to me because I exist. Here I am. I'm a psychiatrist, and there's things that can go wrong with the brain, just like any other organ in the body. And if it doesn't work right, there's a different set of symptoms. And I'll maybe talk about that in a separate video. But yeah, so sometimes people don't really know how to approach me in a social situation. Sometimes they think I'm analyzing them or something like that. And I always kind of laugh a little bit at that because I ask them, well, are you working right now? I mean, do you, are you working in your off time? Like I'm only analyzing or trying to help people and fix people as a clinician when I'm getting paid to be a clinician. Yeah, somebody can ask my opinion or something about things, and I'll be happy to share that. But yeah, in social situations, I'm not trying to work. I'm trying to be social. So, but yeah, being a psychiatrist. It's challenging to get there, but it's very rewarding because you get to see people be happier and reach their full potential, as best as possible, and you could be an instrument in that process. So it's very rewarding. I think a lot more so than a lot of other fields of medicine where, you're helping people and healing people, but you're just one and done, like let's say you're fixing a hip or replacing a joint or something like that as a surgeon. You do your surgery and they're gone, you may follow up a couple times with them, but you're not getting to know them and their family and their struggles and their challenges and them as a person, and to help people become the person that they want to be and see them grow and develop as best as possible is very rewarding. It's also very challenging to see people struggle, especially if they're on drugs or, not following up and just really having a hard time. it is very rewarding, and I do recommend it. And the pay, pay is good, and the job security. How can you beat the job security as a psychiatrist? So I hope this helps. If you have any other questions, about what it's like to be a psychiatrist, please ask and subscribe to this channel. I'd be happy to blather on some more and bore you to death.